and to welcome Egmar, who's been a visiting professor with us since September, and keen to network, not just in Exeter, but with people around the UK. So please do get in touch and connect if you haven't had the opportunity already. Okay, without further ado, I'll hand over to you, Egmar, to get going.
Okay, thank you so much. Thank you very much, Chris and Kat. I would like to start this talk titled, I Want to Change the Community Participation of My Child with Cerebral Palsy, Preliminary Results from the PartiCipa Brazil study. I am a physiotherapist from Brazil, and I am a professor working in a federal university, and I'm spending 1 year here in Exeter University learning from PenARC about the PPI experiences, and during this time I'm analyzing data that I'm starting to present just now. So I would like to talk about 3 important things in this section. First, about the concept of participation and what represent desire for change, and talk about this indicator on dissatisfaction, and present results of community participation of Brazilian children with cerebral palsy. First of all, I would like to talk about the meaning of participation. The first initiative on conceptualized participation came from WHO in 2001, when they published the International Classification of Functioning Disability and Health, ICF. And in this framework, they define participation as the involvement in life situations. When we think about this sentence, involvement in life situations, we can realize that it's a very broad concept. Because of that, if you take the meaning of participation from the ICF model, it's quite hard to operationalize participation in terms of evaluate and intervene. So a group from Australia led by Christine Ames have done a big effort in sense to mind the gap and to contribute to understand better what participation means. So they proposed a family of participation-related constructs to comprehend participation, considering 2 aspects: the attendance, which means being there, and the involvement, which is the subjective aspect of the participation, and represent the experience of participation while attending. When we look at these 2 elements from the family of participation-related constructs, it's much more easy to understand participation when we analyze this perspective only considering the involvement of a person in everyday situations and in society. Because from this perspective, we understand that participation could be the frequency of participation, being there, and also all the subjective aspects of the participation. That means involvement. It covers elements like motivation, persistence, engagement, self-esteem, and level of affect. So it's much more easy from this perspective use and implement participation measures and participation interventions, because after this model we can look at some measure or some tool and analyze if it covers on attendance aspect of participation or, for example, involvement and satisfaction. A new publication from a German group, it's just a few months ago published. I would like to discuss because they also were interested into increase the comprehension of the meaning of participation, and they do it focus on the social participation. And the good thing is that they put in the same line or in the same box involvement of participation and satisfaction. Because I'm very interested in explore desire of change as an indicator of dissatisfaction. So I think it's very interesting also considering this perspective that this group have proposed. And what we know about the participation of children with and without disabilities. Since the publication of the ICF, WHO have done a call for participation should be a key outcome for rehabilitation programs, because participation is an indicator of health, of well-being, and we know that children that have good levels of participation have good results in terms of self-esteem, self-determination, and relationship with others. We also know from research with children with disabilities that they have low levels of frequency of participation and low levels of involvement of participation. But we have just a few papers published about the desire for change. Because of that, I think we need to amplify our interest in this outcome. That means satisfaction or dissatisfaction. I would like to present the PartiCipa Brazil study because we are doing a huge effort in the sense of to create functioning curves and trajectories of activities and participation for children and adolescents with cerebral palsy in Brazil. We are a team of 7 professors of public universities in Brazil, and we are recruiting children for all regions in Brazil. This study started just in the same time of the COVID outbreak, so we need to convert all our data collection in remotely. So now we have some interesting results on motor function of our children, hand function, and other core mobilities. So I will present here results on participation from this study. In how we are measuring participation. So we are using the participation and environment measure children and youth, the PenARC. It's the main tool used around the world to evaluate participation. It was created from researchers from Ken Child in Canada. It's apparently reported to for children from 5 to 17 years old with or without disabilities, and it take account the last 4 months, considering activities at home, school, and community. As you can see here, there are available a lot of different versions of the PenARC around the world, and we are involved in the Brazilian Portuguese version. So I would like to present one part of the PenARC, especially the community section. Here we can see the 5 items from the participation, and the first part is about frequency of participation. So you ask about, for example, neighborhood outlines, how many times the child participated in the last 4 months. If this child participated in some frequency, we ask about the level of involvement. And at least in the end, we explore about the satisfaction or desire for change. So the parent or the caregiver can respond if he or she not desire change, or yes, desire want that the child do more often this activity, less often, be more involved, be less involved, or be involved in a broader variety of activities. So this outcome will be our main focus in this section. Is the second part of the PenCY, is the environment section. For the community part, we have 16 items that cover aspects of the physical, social, and attitudinal environment. For example, the physical layout or amount of space in the community. Is it a problem for the child participate in the communities? Always considering the last 4 months. So how we have analyzing data from the PenCY? I'm not sure how many people from this audience have been some contact with the PenCY, but if you have, I'm sure we have some problems to obtain scores from the environment part of the PenCY. So because of that, we have created the PenCY Brazil calculator, because we understood that it will be very helpful for researchers and practitioners, because it's a more secure way to obtain the scores for the PenCY. So here we can see the graphicals that the Brazilian PenCY calculator generators, and here we can see only the results from home, school, and community, the participation section, and the environmental section. So I will present the descriptive analysis of these data related to desire for change, and some analysis of the variables of interest. So we have recruited 175 children, mean age 8.7, from almost all areas in Brazil. For now, we have more children from the southeast Brazil. And the first part of this study related to explore desire of change, it was to create the PartiCipa Brazil PPI group, because I'm very interested in to start this movement in Brazil. We don't have much initiatives in this sense. So we create an invitation, talking about the dissatisfied of the participation in the community, and if some family were interested in collaborating this study, they could put in contact with me. So we started 1 month ago. So 5 mothers responded and were involved in this part of the work. So I was interested in to discuss about this data and how can we do it in a very attractive and easy way because the level of these mothers, the educational level, were very low. So my idea was to create a menu of participation, of community participation. It's like a menu with ingredients. So I named it the variables of the child in child ingredients, the variables of the family in family ingredients, and the variables of the environment as environmental ingredients. And these mothers help me about to identify for each ingredient, some image or picture could be representative of it, because it will be helpful for the next steps of the investigation. So we put like ingredients for satisfaction, and for the child ingredients or variables, we put in the menu the 12 variables that we have included in the study, 5 variables from the family, and the 16 items from the environmental section of the PenARC we put here, and they help me to identify for each item. One picture could be useful to identify better which means the item. My idea, it was when we finish this study or this analysis, we could use this menu to have ingredients to facilitate or to guide health professionals to plan one intervention at individual level, no? So which results we have obtained at in this moment? We have found that more 60% of the families were dissatisfied with the community participation. Here we can see the 10 activities in the community section of the PenARC, and we have the top 4 activities that parents expressed more desire for change were classes and lessons, organized physical activities, unstructured physical activities, and religious or spiritual activities. Interestingly, in 2 activities as working for pay and overnight visits or trips, they have less than 50% of desire of change, and we understand that it's because our sample is a very young children, no, the mean it was 8 years old, and in Brazil, the law allow us working for pay only for 16 years old. In the same sense, overnight visit or trips is not very common in this age group. The other strategy that we have created was to build in visualization of these data in the Power BI program. We created 7 dashboards with data from these 175 children. And the first part of the data was to put each item of the community participation. So here, it was much more easy to identify the percentage of desire of change of the sample according each item. As we can just have saw in the last slide, the top 4 of activities that the parents expressed more desire for change were classes and lessons, on the structured physical activities, organized physical activities, and religion or spiritual activities. So in this, it's a very attractive and interactive way to show data and to discuss with these families, especially because in the program we can show, for example, change the GMFCS level, and this result change in an interactive way. So if we are discussing with a group of 3 families of children that don't walk, we can just select it in this box GMFCS levels 4 and 5, and these results change and show according these GMFCS levels. The same strategy we have done for the type of desire for change. So here we can see parents could indicate change related to variety of activity, frequency of activity, and level of involvement. They also could identify 2 kinds of changes, for example, involvement and frequency and variety. So here in these first 2 pictures, we can see that the most type of change desired was related to variety. In this one, the same for classes and lessons. When we analyze, for example, the item on structural physical activities, we can see that the type of change desired more frequently here were related to intensity or frequency of activity. In the PPI group, you also were interested to have for each one of the 10 items of the community section of the PenARC have a picture or image that could be represent better the item. So for example, neighborhood outing. So they chosen this picture from Canva, and we can show in a large image the graphics representing the percentage of desire of change and the type of change desired. The final part of the Power BI was related to environmental results. So in the same way, we can change the results according to the GMFCS levels. And for each item of the environment aspects of the community, we have results. And we put in red, like a red flag, when the majority of the sample or represent a problem. For example, here in red is the response about usually makes hard when the physical layout or amount of space in the community was hindering the participation of the child. The last items of the environment section of the PenARC represented in the dashboard of the Power BI. And now I will start to present the results about the ingredients of child, family, and environment related to desire for change. From the 12 ingredients related to child, only 1 was significant, none from the family was significant, and from 16 from the environment, we had 9 significant. Let's see what was. Only the intellectual disability was related in this point of analysis with more desire for change. So from this data, we can see that more children or more families with children with intellectual disabilities reported desire for change in the community participation. When we analyze the ingredients or variables from the environment section of the PenARC, we found that cognitive demands, social demands, physical layout, physical demands, attitudes, enough money, information, weather, and programming service were the ingredients that were related to desire for change. The interesting is that, yes, now we can confirm that the majority of parents were dissatisfied with participation of their children with cerebral palsy. But we don't know if we have these ingredients actually combining, if they determinate more or less the desire of change. So now we have a professor from statistics department working with my data to obtain models from machine learning. So we will predict the percentage of desire for change and identify which these variables or ingredients that we have named influence this desire for change. So it's our main interest because we think that it's a very powerful way to predict results of community participation, and based on this data, we can organize the menu for participation and start to work on implement interventions. So thank you, and are you available to discuss these results or other questions that you could have?
Thank you, Egmar. That was really lovely, succinct, clear presentation.
Hi, thanks so much, Egmar. That was really good, interesting presentation. I think I was wondering, you could change by GMFCS level the results on Power BI, which I really like. That's a nice touch. How much variation did you see? Were there big differences between the GMFCS levels, or was it similar?
It's a very interesting point, Marilyn, because I think in the same way when I have found some results from my PhD when we analyzed the levels of enjoyment of children with participation in Spain, we saw that the frequency of participation and the intensity of participation varied a lot according to GMFCS levels, but the level of enjoyment not. So it was good because they enjoyed, participated. I think for now, we need to do more analysis with the learning machine. But for now, GMFCS does not relate it with desire of change. So I think it's good. But let's see for the next analysis what we can find.
It would be interesting to know how what your findings compare to other countries or situations.
It's a good question, Rebecca, because I think when I started to move on to look at desire of change, it was because most of research was only focused on frequency and intensity and involvement of participation, considering only these two domains of the PenSY, and desire of change was left behind. So I saw only one study is from United States, but using the YCPEN, the young children version of the PenSY, and they used this measure to identify the dissatisfaction levels of children, but not with only cerebral palsy, with a chronic health condition. And yes, they identify that some aspects of the child could be interfering on participation, but most of them were related with the environment. So it's like we are going with similar results, I think. moving in the same aspect. But we have only this study from Mary Catani with children with chronic health conditions, and another one, but it's a very general physical disabilities. And they only explore one a very small piece on the paper. So I think we need to look more. If you have data from UK, I know Leslie has some results from her PhD study, but I think it could be very nice to look at these outcomes also.
Thank you.
Thank you.
I've got a couple of thoughts as you went along, particularly in the way that we're measuring participation using. So I'm aware of this tool, the PenARC, but I've never used it. One thing that surprised me was the recall period is in the last 4 months. To be honest, I can't really remember what I was doing 4 months ago. So it's quite a difficult one for parents to remember what one of their children were doing 4 months ago.
Yes, Chris, I think it's a problem of all participation, or in the same way quality of life tools. They have mentioned about one window of time. So they recommend, and we have used it, the strategy to looking for one very specific and important date that was in the last 4 months. For example, if you are in April, let's think about all activities that your child have participation since Christmas until now. So we have a very concrete part of the time. I know it's difficult, but it's a strategy that they recommend and we are using to facilitate it.
It might help to although it's difficult to remember it, it might help though to accommodate for the fluctuations in people's, physical health as well, mightn't it? They might be participating in some activities less often because they're having a high amount of pain right now, or something's changed in their experience of their condition.
Yes, Becca, I think it's real. And the other thing that I would like to comment related your talk or concern is because in the last, I think the majority of studies on intervention to promote participation, when they use it PenARC as an outcome measure, they don't have, it's like the PenARC didn't have powerful sensibility to capture differences before and after the intervention. So one of the points that we have discussed in the lot about, it's because it's the time window. It's difficult because the points that we are discussing just now, and it's not easy to answer this measure. I think for us that we have a good intellectual level, we can see we can take 30 minutes to answer. So it's not easy. So and if you are doing it in an interview process, because it's the way we are using in Brazil, it could be very difficult for families to answer and to be engaged, motivated to answer in a real perspective. So it could also interfere in the response.
Yeah, it's quite a cognitively challenging question.
Exactly.
Leslie, did you want to come in?
But that was excellent. Thanks, Egmar. I want to sort of reiterate what you said about the cognitive ability, because we said I think you've got to be the cognitive ability of about 12 years old to answer it. So we did the questionnaire with our children, with our families, but we did go through it the first time with them because it's a very complicated questionnaire. I think you need to talk them through it because the wording isn't necessarily the easiest. It's the same in Brazil, but even though it's English, it's still difficult for our English families. So it's something to do as well. Like, is it to the questionnaire? Also, we put mum and dad do botulinum on top, so it was easy to have a reference for them because I think they do need to have a reference point because it's hard to remember. So that generic 4 months or whatever. So it's just really to support what you said. I think it's a good questionnaire, but I think you need to work hard at it as well.
And your participants didn't have any support, Egmar? Were they able to telephone, or if they couldn't understand it?
Most of them, we had a video call to do the
You did.
it's like an interview. It's not a face-to-face, it was remote, but it was in a video call.
And of course, it was during COVID, some of it. So that there might not have been as many opportunities to go out in the environment or groups running.
Yes, I understand your concern, but it's the study started on COVID outbreak, but when we started this data to collect, it was 1 year ago. So yes, we don't have this kind of bias related to COVID or interfere of community participation.
The middle question in the questionnaire was about how involved.
Yes.
How involved, and I wondered if that was again sort of cognitively quite.
What is involved?
How you judge that if you're participating, how do you judge?
Yeah.
Whether the child is that about need for assistance, or that they went to the group but they didn't really like it, or have any thoughts on?
I think it's a great question, especially because we are working with the young version of the PenARC. It's 0 from 5 years old. So from how we can measure involvement of a baby, with 6 or 7. So a very good strategy. It was they build a video explaining in a very visual way how children can be involved in activities and not depending of do the activity, because most of our CP children, GMFCS levels 4 and 5, they can't do the majority of the activity, but they can participate and be involved and have express interest and engagement in a different way. So they explain it that the involvement, we can be attentive about the eye contact, with smile, some special facial emotional expressions that the child could experience during the activities. So for the YC-PEN, they recommend we are show the video before the interview with families. So it's a very powerful way, but it's hard when we didn't have this kind of information before to pass the questionnaire. It was difficult because involvement, as we can see, we need to advance 15 years to understand better what involvement means. No, so it for us, we are doing a lot of research in this field. You can imagine how hard it is for families contest about it. Yes, you're right, Chris.
I'm fascinated by this topic. My PhD all those years ago, 20 years ago, was on measuring participation using different measures that were limited in other ways. I noticed, so for the desire for change, when you presented the results, it was a yes, no. But on the questionnaire, it looked like it was more based on a 5-point scale.
Exactly. we have two options to look at this data. The first one is to look at they want or not change the participation. The second part is to look at what they want change. No, the question is when they can ensure more than one option, we need to combine these options. No, Chris. So we need to when they have they want that children do more often and also be more involved. So the change desired is a combination of intensity and variety. So now we are just studying how we can design it to explore and understand. In this point, we are only doing analysis regarding want or not change the participation of the children. But we would like to understand also this question: which kind of change they wanted for the next steps.
Thank you. So I'm not a parent, but you are, and there are some other parents on the call, and I just wonder the extent to which any or even all parents would want their children to experience more of
concern from parents.
You would want Charlotte to do more in different things.
Yeah, I think it's a very good point. If you analyze only the desire of change, I think we can have this bias, maybe, because we need to take account that parents have the tendency to want more and more for their children, historically. But when we analyze, Chris, the research about children with disabilities, we have some real facts about what they are experiencing. We know from, despite the country, with a very, I think, 2 or 3 exceptions related to maybe Denmark or Sweden, we can have children with disabilities have lower levels of frequency and intensity of participation. So we are looking the desire of change considering this perspective of this group of children. You mean? I don't know if you understand.
I mean,
yeah.
Generally, all parents of any children will want them to experience more.
Yeah.
Leslie suggested that some of them should be experiencing less frequent or less intense video games.
Yeah, exactly. Exactly.
Or time on the phone.
When in the home section of the PenSUI, it's this activity, video and computer, and I think it was the only part when we have they be doing less frequency and less involved. I think it's only in this activity. Yeah. Yes, Javier, I'm seeing your question. In this project, we are including children from 0 until 17 years old. So we don't have this aim from this study, but in the same way, I can add that Can Child just have published a new tool named Pen Plus. It's self-informed, so the children and young people can report about their participation. I think it's a very powerful tool because it's self-reported and I don't have much more information because I'm not involved in the translation in Brazil, but there are some people doing it, and I hope it could take less time to finish, because I think it could be more useful to practical settings. But I think it could be cover your question, because we can follow this part of the life of people with CP or with physical or other disabilities.
I mean, I was tempted to start talking about the concepts, because that's when you opened up quite thoughtfully about what participation is, and attendance versus involvement. Or engagement. What makes it so difficult to measure is for these aspects of participation to be sufficiently accessible to all children, and yet they become slightly vague, as you wonder whether you're comparing like with like in terms of the opportunities that children and young people are having. It really is just quite a complex area to distill into a quantitative measure.
Yes, I agree, and I think we need to combine efforts in the sense to advance in this field, because if you are interested in to implement more initiatives to promote participation, Chris, we need to follow how things on participation are happening. So if you don't have good measures, no, how can we assure us that we are improving the participation? I like you. I like the qualitative research. I think it's a very powerful, but it's good when we can combine qualitative research with some good and robust tools to measure it. So I think it's like we have a big responsibility into continuous studying and those things, combining for strengths, no, to advance and to have in the next years more good information, no, and how to do it better.
Yeah, I think there's sort of pros and cons to the one big measure that is aiming to summarize participation, or whether more granular measures that focus on specific areas of
Exactly
of functioning in school, or
yeah.
In other domains more specifically, rather than the big measure that does claims to measure everything.
Exactly.
But,
yeah, I agree with you.
Yeah. Okay. Well, thanks, Egmar. It's been really.
Thank you so much.
Really
it was
good.
very nice.
Thoroughly enjoyed that myself. Hope everybody else has.
Yeah.
Thanks for coming. And there we go.
Thank you.